to talk to you about a treatment coordinator role in your practice and how can you integrate a treatment coordinator. And what's the role in general? What does he do? And if you hear about that before. So first, for credibility, my name is Khaled. I have been a dentist for 20 years. I own my own dental practice, Lakeside Dental Spa in Hervey Bay in Queensland. I took it from 1 chair to 10 chairs and from 3 staff members to 40 staff members over the course of 14 years. And you can check my details below for credibility. So what is a treatment coordinator? A treatment coordinator is someone you can employ in your team who can coordinate your treatment plans to your patients. So a little bit different than front office reception, a little bit different than dental assistant. Ideally, you want to employ or start this role if you are doing a lot of comprehensive dentistry like multiple crowns, full smiles, dental implants, orthodontics. So dentistry that requires a lot of communication with patients. They have a lot of questions to ask. You need someone to answer those questions on your behalf. And there's a lot of different appointments need to be set up, different payment plans need to be set up, or way of payments as well. So my advice to you, if you're a solo practitioner, and you're doing just really basic general dentistry like single crowns every now and then, or fillings and surgical work, you might not need this role. But if you're a solo practitioner, you start to jump into doing orthodontics or really complex dentistry and sedation, and it might be a good idea to start getting this role established in your practice early on. And you can custom make this role however you want it to make. You can say, okay, the treatment coordinator will see patients who require multiple root canals and crowns, who requires implants, who require full mouth rehab, Invisalign, or you can just say they're only going to see the patients who require sedation and general anesthetic. Things that they require like a consultation room if they can. If you can have a dental chair for them, that would be great, because now they can take scans, iTero scans, they can take photos, they can do charting for you, and you can walk in and confirm all those records. And you can have a conversation with the patient and then give all the information to the treatment coordinator so they can talk on your behalf to your patients. Also, they might require their own phone and email as well, so patients can communicate with them directly instead of going through the practice reception, especially if you have multiple staff in your reception. Now, if you're a large practice, let's say 4 or 5 chairs plus, and again, you're really doing simple general dentistry, you might not require this role. But if your associates start jumping into more complex dentistry, and you're not sure whether to hire a TC or not, or a treatment coordinator, you can always start as a part-time, give them 3 days a week or 2 days a week, and the other 3 days just purely reception role, and then see how the demand will go. If they're always fully booked in their TC days, you can increase their days as you progress. I believe in my practice now I have 2 TCs. That's how much we have grown over the years, and I believe they are very valuable in your team. Those patients require a lot of care in terms of the questions they need to ask and their question is answered. Ideally, they need one point of contact. Instead, if you have like 3 or 4 staff members at the reception, it's much easier for those patients to just have one point of contact and one person to ask the questions and coordinate their appointments. So, think about this. And one more thing, if you want to learn more how to integrate this, there's one course I recommend by Dr. Neil in Brisbane. I think Practice Ownership Seminars is his company. You can reach out to him on social media or on his website. He runs a really good course on treatment coordinators. He shares a lot of information in a very generous way, and my TCs were trained in his course, and you should give him a try. If you find this information helpful, make sure you like and share it with your friends and colleagues. If you want to hear more about my videos, please subscribe to my channel, turn notifications on, and you'll be notified when more videos are released. Thank you so much for listening to me. It means a lot to me.